Hello, everybody, and welcome to another Agile IT Tech Talk. I'm your host, Sean Spicer, and today, following our series of COVID-19 topics, we're going to be exploring how healthcare organizations can leverage Microsoft Teams for both expediting patient care procedures as well as enabling remote work for non-essential personnel. One of the issues with a fast pandemic like COVID-19 is assuring that our healthcare providers and support personnel remain healthy. And just as we're flattening the curve by staying at home and avoiding spreading the disease, many healthcare organizations have enabled remote work and telemedicine policies to slow the spread. Personally, one of my cousins is a practitioner who has moved entirely to telemedicine and is consulting with patients who are concerned that they may have COVID-19 digitally first before they're coming into a hospital environment and putting themselves and others at risk. So today we're going to be looking at the basic communication and collaboration tools within Teams, how electronic healthcare systems can be integrated, how PowerApps and Power Automate can be figured for a inventory control system, and how to empower first-line workers to automate their own processes using a low-code, no-code environment. Just this morning, I read an article that PowerApps has a true no-code solution that is in beta right now. I have not had a chance to look into it yet, but I'll probably have this as a topic for a future Tech Talk. We're also going to look at how Power BI can provide at-a-glance dashboards, and we'll look at planner, meetings, shifts, and the compliant mobile solutions that are offered by Teams. So one of the things, and we've got past Tech Talks around compliance in Teams, is that using Teams allows you to maintain HIPAA compliance no matter what devices are used. Now, while the subject matter of this demo is healthcare oriented, all of these tools can be used by any industry. If you have questions about how you can apply these tools to your own organizations, feel free to let me know in the questions box. A caveat, pardon me, Microsoft has seen a 9-time spike in cloud utilization during COVID-19. And as a responsible member of the CIE facilitator community, I'm not going to be using a demo tenant for this session, and I'll be using a pre-configured demo. I do have our own tenant ready for the Q&A session. So like I mentioned, please ask questions during the session, and I can show things off in a live environment after the demo. So today we're going to be looking at how a fictional healthcare organization, of course called Contoso Hospital, uses Teams. And I'll be taking on the role of Nestor, a nurse unit manager who cares for high-risk patients, potentially in a COVID-19 environment. He is in constant and often urgent communication with other nurses, doctors, and health professionals across the care team and the hospital. So it's imperative that they work together to deliver safe, high quality, and compassionate care for their patients. To do this, they need a seamless technology experience with rapid access to information and the ability to communicate, collaborate, and intervene in a healthcare environment easily while safeguarding patient privacy and meeting those HIPAA requirements. So Microsoft Teams brings patient information from traditionally fragmented health systems into a single place for communication and collaboration that ensures the smooth handoff of patient information while also protecting it. So I'm going to just kick right into it here. So Teams is a hub where multidisciplinary care teams can work together in a single place that keeps the patient at the center of everything they do. It's designed for the whole organization and all the workers, from staff to admins, who work across clinical and non-clinical departments like pharmacy, facilities maintenance, billing, imaging, social services. And Teams provides communication and collaboration channels that break down those traditional organizational silos. So today, Nestor is going to begin his shift reviewing patient statuses and addressing requests and tasks passed on by colleagues and previous care teams. Teams provides this single location for the care team to communicate, coordinate care, and improve operational efficiencies. So it brings together everything in one location. So you have chats, you have teams, you have files, meetings, calls, tools, and the familiar apps that his teams use day to day. Let's see. So let's go ahead and look at the high-risk patient care teams discussion. So here he has access to a single virtualized team centered on a specific topic so they can work together and collaborate on office documents. The team has access to persistent and threaded conversations about different high-risk patients needing attention, as well as huddle topics in history. So here you can see the at mention. This assures that anytime that I'm mentioned as Nestor, I'm notified and I'll have this announcement that, hey, I've been mentioned. So here I can see, because it's in bold, that care coordination has a message for me. Now, messages directed at Nestor are marked with an @ symbol so we can see immediate needs, but there's also this important text or important marker on this message from Lynn Robbins. So here we're going to go ahead and reply and click send. So Teams ensures this consistent and accurate patient information handoff across the care team, so Nestor shares the right information at the right time. Because he stays in one location for meetings, chats, and discussions, he minimizes context switching and can find needed information quickly to make accurate decisions and interventions. Channels and teams are basically specific topics and provide dedicated hubs to hold meetings, conversations, and work on files together. And here you can see, pardon me, let me drink a bit of water here. So here within the high-risk patient team, you can see that we have admissions, announcements, care coordination, and discharge planning. So this allows this team to structure their work and reduce duplication of effort and tasks. Channel tabs allow team members to pin additional information, sources, and reference materials. There's also the calendar. So you can see here, we've got the discharge policies walkthrough for new nurses coming up. And channel meetings incorporate Teams audio, video, screen sharing, recording, and transcription to manage daily meetings. Here you can see that he did not respond to the meeting yet, and you have the ability, just like in Outlook, to accept or decline meetings. And all the members of the team can join or be added to the meeting. So this isn't just per person. The entire team in this Teams channel is added to this meeting and can join if they need to. All chats and notes during a Teams meeting are kept with them and are accessible later for quick reference. This is really nice if you have recurring meetings, because you can see the comments, notes, and all of the other ephemera that is collected during a meeting on a running basis. So we use that here at Agile IT for our all company meetings. And we can see, going back as long as that meeting has been scheduled, all of the comments and commentary through it. Let's go back to Teams here. So clinicians can easily configure ward and hospital templates to predefine a team's channels, install apps, and pin tabs automatically, allowing them to focus on care collaboration rather than spending time over and over and over again setting up a team. So here you can see that this is set up with files, patients, and wiki tabs. So templates allow organizations to streamline operations and deploy consistent teams across the organization, while still remaining customizable to meet every team's specific and specialized needs. The team within Teams is a digital representation of the care team, and the channel here, discharge planning, is their workspace. Tabs provide easy reference to the tools they use regularly, and persistent conversation offers historical information. Here you can see that he has another @ mention in the discharge planning. And here he's able to reply once again, and this time he's going to attach a file. Teams and channels. Now, we've done another tech talk in the past about how SharePoint and Teams work together. Because this file is already saved within files in this channel, it's exposed very quickly. Go ahead and select it, share a link, and here you've attached and uploaded this discharge document to share with your team. Teams provides secure content sharing and collaboration, which can be shared with healthcare employees at any point in time, from any device, anywhere, with the assurance that important documents aren't edited or shared outside of the organization. So let's go ahead and add a tab here. So what we're going to do is we're going to create a Word document here in order to make this visible. So we're going to change the tab name. We're going to put the discharge procedures tab in there and select it up. We do not want to share it to the team. We're going to go ahead and select that. And now we've got this file available in a tab. So anytime you come into the team, it's there at just one click. So that integration with SharePoint allows the team members to quickly add tabs to provide access to information, all while staying within their workflow. And this is not limited to Word documents. This can be other applications. This can be SaaS apps. And in this case, this is an EHR integration. So Microsoft Teams brings together information from siloed operational systems, such as electronic health records, using fast healthcare interoperability resources, FHIR standards. So this, again, keeps you in compliance. The care team will need to track TINA's and other readmitted patients' care in the MDT meeting. So that's the multidisciplinary team. So Nestor creates a new list to track all of the readmissions. So the patient app surfaces the EHR data directly within the care coordination channel, allowing the high-risk patient care team to dynamically collaborate around patient information, all in one secure hub on any device, while minimizing switching between various apps and tools. This integration is also critical for maintaining security. And here you can see that we have all of the entered information on TINA in the EHR. And here clinicians can collaborate around the logistics associated with care coordination, like making notes around release sign-offs, notes about family visiting for rounds, and more. So let's check out a PowerApp. Part of Nestor's duties as a shift supervisor is ensuring that the nurse's station has everything needed for patient care, masks, personal protective equipment. And here we're going to go ahead and make a request. Now, Power Platform integration in Teams allows hospitals or any organization to quickly build low and no code, enterprise grade web and mobile apps that live right where their business happens. The low barrier of entry in Power Platform fosters innovation without limits, and it really empowers those first line workers to create applications that meet their specific needs, and Power Automate allows them to automate these processes. So additionally, this is all within policies, so applications stay within the boundaries and management criteria set by the IT department. So in this case, we're going to go ahead and let's order something. Let's order wipes. We're going to go ahead and order a full 100. We'll want them the next day. And we'll need some special instruction. So it goes to the nurse's station. We can go ahead and sign with our finger and submit. A request has been submitted. Now, in addition to the Power Platform that we've talked about, and I did the demo about crisis communications that shows how to set up the crisis communications application using PowerApps and Power Automate, Power BI is another powerful tool for healthcare. So many healthcare organizations today have multiple campuses spread across multiple cities. Teams breaks down these silos amongst different divisions and campuses and allows disparate organizations to communicate and collaborate openly while gathering and sharing insights and data quickly and easily. So right now we want to investigate Contoso-wide healthcare factors. Power BI, Microsoft's business analytics solution, allows these organizations to analyze and visually present data across the organization so teams can quickly find actionable insights to improve those patient outcomes. So let's look at risk level. So Nestor, being part of the high risk team, is tracking the risk level of oncology patients entering the ER. Healthcare organizations can connect to hundreds of data sources and bring that data to life with live dashboards and reports that can be directly embedded into apps, websites, or tabs right here within Teams. So let's look deeper into oncology and risk level 5. And so here we're going to filter on the high risk level and age group. There we go. So here we can say which age groups and which hospital units have the highest level of risk in oncology. We can look at respiratory medicine. I am really sorry if this is as small on your screen as it is on mine. I'm still getting used to these new glasses. So Nesta would like an oncologist to look into this risk factor and what are the causes and possible solutions. So gone are the days of sticky notes on the edge of the nursing station desk or pieces of paper tacked to bulletin boards. Contoso takes the chaos out of cross-hospital work and gets more done by using Planner. Care teams can easily create new plans, organize and assign tasks, share files, chat about what they're working on, and get updates on progress. So right now we're going to go ahead for a new idea. We're going to add a task. We're going to enter the task name. We're going to assign it to an oncologist here. Got Patty Fernandez. Click out of the name drop down here. We're going to set a due date because this is critical. We want to know about it by tomorrow. And we're going to go ahead and add task. Now, we're confident that Patty will know about the task and help find a solution to a potential hazard. She's going to be notified both within Teams as well as through Outlook. So let's show off the meetings aspect. And if you've been on many of our Tech Talks, you've been in these meetings. I think we have somebody on who's helped me in a meeting recently during last week's demo. So the high-risk patient care team has a weekly MDT, and the care team is often on the go, and in-person meetings can be challenging, particularly as the number of patients goes up and up and up. Pardon me. So here is the meeting. We just click on it here to join. We click join. So built on the Office 365 enterprise grade cloud, Teams helps healthcare organizations accomplish their security and compliance goals. So Teams meetings in healthcare and in any organization that has it configured, they safeguard sensitive and protected health information. Pardon me. I don't have the disease. I've been talking too much. So you've got features like background blur that will blur out any any background information that could be either patients, it could be whiteboards. And so the background gets blurred. We're going to go ahead and join now. Now, this ensures any information just behind a meeting participant in a video conversation is obscured. Furthermore, meeting backgrounds can be personalized to ensure team meetings adhere to organizational brand and professionalism standards. So this empowers clinicians to stay on top of their fast-paced operations and participate more effectively in the right meetings and workflows. The Teams meeting solution supports screen sharing, video, audio conferencing that's accessible from nearly anywhere and on any device. Not only do these meetings give people a way to relay the most relevant information to support strong handoffs across the healthcare team, they also capture that information for future reference in a secure and compliant way. Clinicians can access meeting recordings with transcribed texts that are indexed, searchable, and can be translated with a single click. So here we're going to open up an Excel document that is collaboratively shared. And now we're going to switch over to Alex Wilbur to show what the attendee perspective looks like. So notice we still have the meeting here, but we're going to be able to edit this document together. And you can see here that Nestor is also editing. And now we're going to switch back to Nestor. And now you can see that Alex Wilbur is also editing. And this collaboration is happening in real time. So we're going to go back to Alex's perspective to see editing in real time. And now we're going to switch back to Nestor's perspective to see what it looks like in his on his device. So here you can see Alex Wilbur, it's highlighted, and then we can go in and edit as well, and that's in process. And now there's no need to save. This is all saved immediately into your SharePoint environment and across all of the devices. Everybody's working on the same document. So at this point, let's get out of the meeting. So you can also start a meeting from a channels conversation feed for moments when spontaneous meets are necessary. So down here is the Meet Now icon. And now let's look at shifts. So right now we're going to configure shifts for care team nurses. So Nestor needs to review his schedule for next week. And instead of having to go to the break room and check paper schedules or into an office to check multiple systems, Nestor can use shifts right within Teams, as can everybody else in his team as well. So nobody has to be in a specific area, and it's shared throughout the organization. This is imperative if you're trying to maintain staffing while your teams are working at home. The shifts integration in Teams allows Nestor to quickly review his daily and weekly schedules, request or accept time off, offer or swap shifts, and easily stay abreast of any shift schedule changes within his department. Here he needs to schedule an annual training and certification session mandated by the hospital. So he's going to quickly add Alex Wilbur on Team A. We're going to add a person to group. There's Alex. And we're going to go ahead and, yes, we want to allow this person to update schedules. All right, and let's look at Friday. And where did Alex go? There we go. All right, we're going to go ahead and schedule him. So let's add a shift. We're going to go ahead and set the start time. Okay, let's not make it too early. So 3 p.m. on Friday. End time, no, we don't want to shift that long. There we go, 4 p.m. Go ahead and set the theme. Let's make it hospital pink. We're going to go ahead and add a shift note explaining what this is for. And then we're going to go ahead and save. And we're going to share with team. And this will go ahead, it will update the schedule, and a notification will be sent to your entire team or the affected team members only. We want everybody to know about this, so let's go ahead and share. So Teams brings these care teams together to collaborate in a single place that keeps the patient at the center of everything. This seamless technology experience gives this rapid access to information and gives the ability to communicate, collaborate, and intervene with patients easily while safeguarding patient privacy. It brings information together that's traditionally fragmented across multiple health systems, so your EHRs, any other third-party apps and SaaS apps, into a single place that not only ensures the information remains secure, but also saves time and money while improving patient outcomes. So that's all fine and good when Nestor has constant access to a workstation, be it from a desk, Windows Virtual Desktop, logging into RDP sessions from bedside terminals. But we all know that it's seldom the case that somebody has a desktop around all the time, particularly as more and more patients are admitted and healthcare organizations and hospitals become more dynamic places to meet the needs of this pandemic. So let's take a look at the Teams mobile experience and how it allows Nestor to not only perform some of the same tasks, but how it makes the mobile device its own unique tool in the hospital. So while doing his rounds, he sends an urgent message to Patty Fernandez, Contoso director, regarding Tina Wilkins, who we talked about earlier in the EHR, who is a returning high-risk patient that's shown up with some swelling. So under suggestions, one of the things about Teams is that Teams remembers how you work and who you frequently work with. So this is going to automatically surface Dr. Fernandez. We can click and type in your message. So Nestor's role involves constant and at times urgent communication with other nurses, doctors, and health professionals. So in this case, we're going to set an urgent notification on this. And this will send an alert every 2 minutes for a total of 20 minutes or until Patty responds to the message. The message will also remain on the lock screen of the receiving device, ensuring the recipient will still see it. I'm going to go ahead and insert an image and capture a photograph. So the smart camera in Teams segments out images, so it ensures that healthcare workers don't store images used in patient care on local devices' image galleries. This is critical for compliance. Also, we have the ability to mark things up. You don't have to draw your own picture, though. You can zoom in for details and send. So this sends the message securely through Teams to Patty or Dr. Fernandez. If he were using a consumer messaging app, he would take the picture, store that image on his unsecured, unmanaged personal device. That would put data at risk and would also be violating HIPAA compliance requirements. Since Nestor sent the message using Teams, the image stays off his device and in Teams, where recipients can securely access the data. We have a previous tech talk about Teams and SharePoint better together. I just revamped that blog earlier this week at agilit.com, and it talks about where these files are stored in order to meet compliance. And when you're in a private chat, it's not in SharePoint, it's actually in OneDrive for Business. So just a little bit of information there. We're going to go ahead and send. And now you see this small bit here. Pardon me. And so instead of, well, on mobile devices, you've got your menu here at the bottom. It's a little bit different. So when Nestor finishes his round, he wants to send a more detailed audio message to the channel while walking back to the nurse's station to keep everyone informed on the most up-to-date patient care information. Let's go to the general channel, create a new conversation. And so voice recording allows us to communicate complex information while on the go without needing to stop and type. This is a safety problem. If somebody's looking down, wandering through a hospital, they're going to be bumping into people, risking injury. So here we have the ability to just record. Now, in a live environment, you would hold down the microphone during recording. So this records Tina Wilkins has been readmitted with swelling. We need to add her to this week's high-risk MDT meeting. Because the Contoso IT admin set up a retention policy, this voice message will be deleted after a month, further securing patient information. And these are all within the admin policies, and we've done tech talks on that in the past. I'll make sure to share a link once I get this up on YouTube. So Nestor from his mobile device has access to Teams, conversations, files, and apps from his mobile device while on the floor. Each team is a digital representation of the care team, and just like in desktop, each channel is the workspace. We're going to go back to discharge planning here, and we still have access to those persistent conversations, keeping that historical data available no matter what device they're using. And again, you have access to your files. And this we've seen when it was added in the earlier portion of the demo, you can still view and edit from these applications on your mobile device. So at this point, towards the end of the shift, he's returned to the nurse station now and is performing his daily task of ensuring the station is stocked. Now, I showed you guys the Power App earlier on the desktop. Here is what it looks like on mobile. And again, these are cross-platform applications, and they're really fun to set up. So main campus. Now, because you have limited screen size here, you're going to find your extra tabs here under More. We're going to go to Nurse Station Inventory. It's going to pull up that Power App. It uses SSO to make sure that it is Nestor logging in from the device. If you're using Intune to manage your mobile devices or manage BYOD devices, this also automatically checks device health to make sure that it is in a compliant state. So we're going to go ahead and make a request just like before. This time, let's get cups. We don't need 100 cups this time. Okay, 25 cups. When do we need it? Let's say, ooh, Friday the 13th, auspicious. I'm going to scroll down, click OK. And again, you can sign with your finger right here in the app. Submit. And online storage in SharePoint removes hard copy paper trails and reduces time waiting for supplies to arrive. This request is automatically sent. So now we're going to go ahead and return to home. We're going to go back to Teams. And so since the entire team is often in the go, having in-person meetings and retaining meeting notes and action items is challenging. We went through what it looks like to have a meeting from a desktop, but your teams don't need to have a desktop. They can join meetings right from their phone. Excuse me. And then we're going to go ahead. Where is that September 9th meeting? And join. Video is off. Let's turn that on. We're going to join now. So Nestor knows that some members of the team may not be able to meet at that moment in time. So from his device, he can also enable recording. And recordings are going to be saved in the chat history of the meeting request within Teams, so everyone can access the recording later and keep track of discussion topics and meeting actions without missing a detail. So we talked about shifts from desktop, and he can work on that right from within Teams. So that will be within the app launcher. More apps, shifts. And just like on desktop, he can review daily and weekly schedules, accept time off requests, and just stay updated of shift schedule changes within his department, all in real time. So realizing he has a conflict in his schedule, he can go ahead and swap a shift with fellow nurse on the team. So this no longer needs to be done through email. You don't need to hunt people down to talk in person. It all happens right here. So let's swap or offer shifts. Select your shift, September 18th. That shift, I need to be off. Select a team member shift. Let's just see if Lynn's available. Let's give a reason. That's presumptive. Done and done. So just like with chat messages, Teams will automatically notify when Nestor if she accepts the response. And again, no need to go to break rooms or to a terminal to figure these things out. So not only does Teams allow the organization to customize experiences and provide the tools that their employees need, the individuals can also customize Teams on their device. So you can remove unused icons to customize and add things that you use. We're going to go ahead and get rid of some stuff here, I think. and we can set up the UI for quick access to the most used apps that the individual uses on a day-to-day basis. In this case, calls, and activity, and done. I use this feature a lot. I am constantly being brought in and out of teams, so I'm hiding teams that I'm not always active in. I'm surfacing new teams, as well as in my sandbox environment. I do a lot with adding new SaaS apps and just trying out the different things that can happen. So here we're going to see how that looks now. And here you can see the activity app is now the first in the list of more apps. A quick tip on this is think about where your thumb is when you're positioning icons. My thumb tends to rest about here, and I keep my third row of applications on my phone to be my most used. So here we've shown how teams can improve healthcare outcomes with clinical rounding, how it integrates with EHR systems, offers role-based messaging and training in the flow of work, all on any device, and while healthcare workers are on the go, but also how it looks in the desktop environment and all of the various applications that can be brought into this single hub for teamwork. Now, if you're not in healthcare, if you're in finance, if you're in government, if you're a DoD contractor, all of these tools are available. I'm going to add the caveat that in DoD, there are certain limitations to what can be added to Teams, of course, because of the more strict compliance. But listen, healthcare is one of the most regulated industries out there. And if Teams can provide a compliant environment in healthcare, I assure you that we can help you create a compliant environment for your teams working remotely in any industry. So thank you very much for joining us. There will be a link to the full write-up once this goes up on YouTube, along with a couple of the links that I mentioned during the process. If you're watching on YouTube, give us a like and follow. If you're reading this on our blog or watching this on our blog, feel free to leave comments. I love to respond to you guys. It really gives me that connection that I don't have while I'm working in the office. Thanks again for joining, and have a great day.